Thank you. Mr. Culberson.
Thank you, Mr. Chairman. Thank you, Mr. Secretary. Heard you talk a lot this afternoon about the importance of bringing down the deficit, controlling spending, and I appreciate you saying those things. I wondered if you would tell us, for the record, could you explain how the creation of the Obama health care entitlement will help bring down deficits?
Happy to do that. That's not the way I would describe the health reform plan, but I'm happy to answer the question. The CBO estimates, and they're the independent scorekeeper of the Congress, they estimate that the reforms that are in prospect now would reduce the long-term deficits, the 10-year deficit, and would substantially reduce the rate of growth in health care expenditures over the succeeding decades.
Are you talking about the Senate bill?
Well, I would say that you can take the Senate bill. You can take the Senate bill as with the suggested changes that the administration put out a few weeks ago, but they're all in the same basic ballpark. You say a meaningful reduction in the 10-year numbers and a very substantial reduction in the succeeding decades, and that's because, as you know, that the biggest driver of our long-term deficits is the rate of growth in healthcare expenditures. It's much more important than, for example, the fact that our population is aging. So there is no path to fiscal responsibility that does not go through healthcare reform that reduces the rate of growth in costs.
But the reductions they see in the future are all based on assumed reductions in healthcare expenditures in later years.
Well, again, what they always do is they take proposals Congress is considering, and they quantify those estimates on future spending by the Congress. They're just doing what they always do in that case.
And you recognize that those proposals entail 6 years of spending with 10 years of revenue.
But again, I'm not trying to characterize their proposals. What I said is accurate in their estimates of the fiscal costs.
You're talking about CBO.
Yeah, CBOs. But again, the most important thing to point out, which I know you understand, is that if you care about the fiscal position of the United States, if you're worried about those long-term deficits, there is no way to deal with that without reforming the healthcare system in a way that reduces the rate of growth in costs.
Well, for those of us on the fiscal conservative side are approaching it from the perspective of focusing on making health care affordable and portable so you can buy it across state lines and shop. I want to be able to buy coverage from a carrier in Arizona or Texas. That law needs to be changed. We want to focus on that. On medical malpractice reform to protect doctors from frivolous lawsuits has worked so successfully in Texas. On allowing small businesses to pool their ability to negotiate better rates together. We could do those things without and bring down the cost of health insurance and make it affordable and portable. And that's where, from our perspective as fiscal conservatives, the focus needs to be. But the I just have to tell you, the credibility of the administration is not very high when you or the administration attempts to persuade taxpayers who are, they pay attention and it just defies common sense to believe that we can, that as your proposals do, expand coverage to 20 to 30 million new people are going to be brought into this new entitlement, which is clearly the mother. This is the mother of all entitlement programs. That you're going to bring in 20 to 30 million new people.
Again, all I'm doing is citing,
you're going to reduce deficits, and this is just. It's not credible. It's just not credible.
All I'm citing is the estimates of
CBO. Do you believe those estimates are accurate?
Well, I think they're the best estimates we have. And again, they have the virtue of being a fair, independent arbiter, nonpartisan arbiter of the proposals now working with Congress. So you can challenge those things, but those are the ones Congress will rely on to score your proposals as well as the administration's.
We are, as you have said, in an unsustainable fiscal position, and I am as concerned as I know everyone on this committee is, no doubt, that we would become Greece. And
let me say, Congressman, there's no risk of that. That will not happen in the United States.
We are spending money as of June 1st. We're running on the nation's credit card. My office has calculated, and if you look at the available revenue as of June 1st this year, everything we spend beyond that point is borrowed money. And the scale of the deficits, and it is a fact, and I have to say also, in your opening remarks earlier, Mr. Chairman, if I could very quickly, we're kicking the Bush administration. You can't just blame others for the scale of the deficit. The deficits that you inherited were way too high. I voted against virtually all of those major Bush spending initiatives. But this, Nancy Pelosi and Barack Obama have managed to spend over $2.5 trillion in about 1 year. Even that's just the big ticket items. You spent more money in less time than any administration in the history of the United States. You've created more debt than any other administration in your budgets than any administration in the history of the country. So it just isn't credible. You damage your own.
I would be happy to measure our record on fiscal responsibility